Hello, everyone, and welcome back to Smile Sessions with Dr. Tony. This is the place where we break down dental health in simple, everyday language so you can actually use the information in real life. I'm your host, Dr. Tony, and I've been practicing dentistry for over 15 years. I've seen everything from routine cleanings to the kind of emergencies you never expect, and that's exactly what we're talking about today. Dental emergencies are the kind of thing nobody wants to think about, but everyone should understand. When something hurts or bleeds or suddenly feels wrong in your mouth, it can be scary, but a little preparation goes a long way, and that's what I want to give you today. Before we begin, a quick reminder that this isn't personalized medical advice. If you're dealing with an emergency right now, please get in touch with your dentist or head to urgent care if it feels severe. Let's start from the very beginning. A dental emergency is any sudden issue involving your teeth, gums, or mouth that causes pain, swelling, bleeding, or puts you at risk of permanent damage. It can come from an accident, an infection, or even a small problem that was ignored for a bit too long. The silver lining is that most of these issues are treatable when addressed early, and many are preventable altogether. One of the most common emergencies is a severe toothache. You know the type. The throbbing feeling that wakes you up in the middle of the night and seems to pulse through your whole head. What's happening inside the tooth is actually pretty simple. The inner part of the tooth contains nerves and blood vessels, and when it becomes inflamed from decay or a crack, those nerves send constant pain signals. If the swelling gets worse, the tissues around the tooth can press on even more nerves, turning the pain from annoying to intense. At home, rinsing with warm salt water is a great first step. It helps calm the area a bit and reduces swelling. Over-the-counter pain relievers like ibuprofen can make a big difference because they calm inflammation and ease discomfort. But if the pain sticks around for more than a day or comes with swelling or fever, that's your cue to see a dentist. It might be an infection that needs professional treatment, like a root canal. Keeping up with brushing, flossing, and regular cleanings goes a long way in preventing this kind of issue. Broken or chipped teeth are another big one. Sometimes you bite something hard. Sometimes you take a hit to the face. Even though enamel is the hardest substance in the human body, it's not invincible. When a piece breaks off, the sensitive inner layer called dentin becomes exposed, and that can make hot or cold foods feel like an electric shock. Even tiny cracks can give bacteria the perfect opening to get inside the tooth. If this ever happens to you, rinse your mouth gently, apply a cold compress to keep swelling down, and avoid chewing on that side. You can even cover the sharp edge with dental wax or sugar-free gum as a temporary fix. Pain medication works here as well. Some people get relief using a tiny bit of clove oil on a cotton swab because it naturally numbs the area. A dentist can usually fix the tooth with bonding or a crown, and it's best to go as soon as you can. Abscesses are one of the more serious emergencies. An abscess is a pocket of infection usually near the tooth root or in the gums. The pain can be deep, throbbing, and hard to ignore. Your immune system sends in white blood cells to fight the bacteria, which creates pressure and swelling. If ignored, that infection can spread, and in rare cases it can become dangerous. Saltwater rinses can promote some drainage and give mild relief, and anti-inflammatory pain relievers can help reduce the pressure. A warm compress can also bring a little comfort, but this is not the kind of problem you handle alone. If you ever notice facial swelling, difficulty swallowing, or fever along with dental pain, you should consider it urgent. A dentist needs to drain the infection and prescribe antibiotics. Keeping up with good oral hygiene is the best way to prevent abscesses in the first place. Now let's talk about one of the scariest emergencies for most people: a knocked out tooth. It looks dramatic, it can be alarming, but it is absolutely possible to save the tooth if you act quickly. The key is preserving the tiny fibers on the root, called the periodontal ligament. Those cells start dying quickly if they dry out. If the tooth falls out, pick it up by the crown, not the root. Gently rinse it if needed, but don't scrub it. If you can, place it back in the socket and bite down lightly on gauze. If not, store it in milk or even your own saliva. Water doesn't work as well. The faster you get to a dentist, the better. Less than an hour gives you the highest chance of saving it. Bleeding gums or bleeding after an extraction are also common. Mild bleeding can come from gum disease or irritation, and sometimes it can signal something deeper. A damp tea bag pressed gently over the area can slow the bleeding because the tannins help tighten blood vessels. A diluted hydrogen peroxide rinse can help keep the area clean. After a tooth extraction, avoid anything that creates suction, like drinking through straws, because it can pull out the clot and lead to dry socket, which is very painful. Jaw pain and TMJ issues are another category of emergencies. Sometimes the jaw joint gets inflamed, sometimes it shifts slightly out of place, and sometimes muscle tension ramps everything up. You might hear clicking sounds or feel pain when you chew. Ice can calm early swelling, while heat helps relax tight muscles. Eating soft foods and resting the jaw can make a huge difference. Finally, there are soft tissue injuries like biting your tongue or lip. These bleed a lot because the area is so rich in blood vessels, but the good news is they also heal quickly. Cleaning the area, applying ice, and using a simple numbing gel can help for minor injuries. That wraps up the first half of today's episode. I hope you're starting to feel a little more confident about what to do if something unexpected happens. Stay with me because in the next part, we'll cover even more common emergencies. Things like lost fillings, orthodontic issues, dry sockets, cracked tooth syndrome, and even allergic reactions to dental materials. All important stuff, and all things you'll be glad you understand before you ever need it. See you in part 2 of Dental Emergencies.